Although uncertainties remain in how the trajectory and the virus itself might evolve going forwards, there is no doubt that our best bet is to maintain vigilance. We should not forget the personal protective habits we have learned as we resume activities and return to more settings. Next week will be the 2-year anniversary of the WHO, or World Health Organization, characterizing COVID-19 as a pandemic. Since then, we have had an intense apprenticeship in the prevention and control of this new disease. Individually and collectively, we've learned so much about how the virus behaves and what measures work to reduce the risk of exposure and spreading the virus. By getting vaccinated, millions of Canadians have increased their protection against serious illness. And we have all taken measures to protect ourselves and others by being aware of the risks in our communities, staying home when we're sick, adjusting plans, and adding other layers of protection, such as wearing masks. Now, with a strong foundation of protection from vaccines, proven practices to reduce spread, and less intense pressure on our health system, we need to turn our focus on easing societal disruption. But regaining in-person social and economic activities while the pandemic is still ongoing and the virus is not going away, it means we must use all that we have learned to do this safely and make it last. With March break coming up, there will be more opportunities for gatherings, travel, and activities. Going forward, individual risk assessments can become another one of our good habits, as important and routine as checking the weather to decide what activities are best to do and what essentials to bring with us. Regularly checking in on the local epidemiology where you are or where you are going is important for keeping up with recommendations, as well as for making informed decisions on what precautions to use. In particular, if you're traveling this March break, getting up to date with COVID-19 vaccines, including getting a booster dose if you're eligible, and especially for those aged 50 years or older, is important preparation for safer activities and travels. And whether or not they are required in the places or settings you are in, masks remain an important layer of protection. While the virus is still circulating, mask wearing and other personal protective practices offer a way for you and your family to reduce your risk of exposure and spreading the virus. Getting back to more of the people, places, and activities we love is important. This is a time of recovery, as well as time to address the broader impacts of the pandemic, while being ready to respond to future potentially severe waves. By continuing to work together and supporting those at the highest risk in our communities, we will be better equipped to work through future challenges that may come our way. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. À l'échelle nationale,
nationally, weekly case counts are down by 4.5% compared to last week, and average daily numbers of people with COVID-19 in hospitals and ICUs has declined by over 15%. However, the SARS-CoV-2 virus is still circulating widely, and the epidemiological situation is variable across the country. While some jurisdictions are currently reporting increased case counts, ongoing easing of public health measures could lead to increased transmission in more areas over the coming weeks. Although uncertainties remain in how the trajectory and the virus itself might evolve going forward, there is no doubt that our best bet is to maintain vigilance. We should not forget the personal protective habits we have learned as we resume activities and return to more settings. Next week will be the 2-year anniversary that the World Health Organization characterizing COVID-19 as a pandemic. Since then, we have had an intense apprenticeship in the prevention and control of this new disease. Individually and collectively, we've learned so much about how the virus behaves and what measures work to reduce the risk of exposure and spreading of the virus. By getting vaccinated, millions of Canadians have increased their protection against serious illness. And we have all taken measures to protect ourselves and others by being aware of the risks in our communities, staying home when we are sick, adjusting plans, and adding other layers of protection, such as wearing masks. Now, with a strong foundation of protection from vaccines, proven practices to reduce spread, and less intense pressure on our health system, we need to turn our focus to easing societal disruption. But regaining in-person social and economic activities while the pandemic is still ongoing and the virus is not going away means that we must use all that we have learned to do this safely and make it last. With March break coming up, there will be more opportunities for gatherings, travel and activities. Going forward, individual risk assessments can become another one of our good habits, as important and routine as checking the weather, to decide what activities are best to do and what essentials to bring with us. Regularly checking in on the local epidemiology where you are or where you are going is important for keeping up with the recommendations, as well as for making informed decisions on what precautions to use. In particular, if you are traveling this March break, getting up to date with COVID-19 vaccines, including getting a booster dose if you are eligible, and especially for those aged 50 years or older, is important preparation for safer activities and travels. And whether or not they are required in the places or settings you are in, masks remain an important layer of protection. While the virus is still circulating, mask wearing and other personal protective practices offer you a way for you and your family to reduce your risk of exposure and spreading of the virus. Getting back to more of the people, places and activities we love is important. This is a period of recovery, and as well as a time to address the broader issues of the impacts of the pandemic while being ready to respond to future potentially severe waves. By continuing to work together and supporting those that are at the highest risk in our communities, we will be better equipped to work through future challenges that may come our way. Thank you.
Thank you, Miigwech.
Thank you, doctors, for that. The doctors have quite a bit of time with us today, so I'll try to get through everyone as quickly as we can. So remember, it's one question, one follow-up, and we're going to start with Adam Hurras from the New Brunswick Telegraph-Journal. Actually, Adam, we're going to have to skip you at the moment because it looks like you're using an older version of Zoom. So with that in mind, Boas Prou from Le Devoir, you're up.
Yes, you spoke at length about wearing masks and about other personal protective practices. But what is your thinking about the fact that Quebec and other provinces have made it no longer mandatory? Is it still useful to have a mask mandate? Response. Well, thank you very much for your question. I believe that I've already answered this question before. Clearly, mask wearing is a well-tested, tried-and-true personal protective practice. Is it a mandatory requirement? Well, no, it's a personal choice under one's individual risk assessment. That is the issue now. Now, it's a question of striking a balance between the measures being put in place by various provincial governments and weighing them up with the recommendations made by public health and also individual choices that one might make. So it's important to continue to inform the broader public with the useful and helpful information, and clearly mask wearing is an additional layer of protection, especially for those who are at greater risk or or more susceptible because they're immunocompromised, for example, or seniors. So mask wearing is a good layer of personal protection. And, sometimes, even if they're mandatory or not mandatory, one should not discriminate or stigmatize those who choose to continue to wear a mask in public settings. Follow-up question. You talked about the future and that we should be prepared for future waves. How will we know when and if the pandemic is over? And how will we know if there's a new wave in Canada that hits us? Could you discuss that, please? Response. That's a great question. And I don't think it's easy to come to the conclusion that the pandemic is over and to come out and say that. But at some point, we've got to accept that the virus is here to stay, both domestically and abroad, for a long haul now, or at least for some time. Now, thankfully, we're reaching a stage where the mortality rates are becoming manageable and having a lesser effect on our healthcare systems, which are managing better and better. But the fact is that we need to continue with our effective monitoring systems and the other tools at our disposal, for example, monitoring wastewater. It's important to use those kinds of indicators to determine whether another variant of concern may be in the process of emerging. For the time being, it seems like we're over this Omicron wave, but it's always possible that another variant of concern with even more serious ramifications may come to light. So we must remain vigilant.
Okay, up next is Crystal Oak from Global National.
Hi there. Thank you for taking my question. Can you hear me all right?
Yes.
Oh, great. So I just have a couple questions on Ukraine. So the immigration minister has announced a national interest exemption to allow unvaccinated and partially vaccinated Ukrainians to enter Canada through specific programs. I was just wondering, what is the protocol at the border if those coming into Canada test positive for COVID-19? And are there public health plans in place to accommodate that?
Yes, thank you for the question. Of course, many government departments are working together to support the safe entry of persons leaving the Ukraine. I think that they will be asked to follow the current measures for vaccinated and unvaccinated travelers that arrive in Canada. Of course, we know that it's very difficult to get tested or maybe have the vaccination prior to arrival in Canada. But for those who are unvaccinated, they will be expected to undergo the usual quarantine measures and the testing regimens that are currently in place. And they will be supported in terms of getting vaccinated should that be required.
And as a follow-up, so Ukraine has a relatively low COVID-19 vaccination rate. Are there any new measures or programs that are going to be introduced for refugees who would like to be vaccinated within Canada?
Well, I think the programs already exist, and the provinces as well as the federal government are all very supportive. Anyone who isn't vaccinated with the current list of vaccines approved by Health Canada or those listed by the WHO are all supported in the provinces and territories to get additional doses as well.
Okay, we're going to move on to Yasmine Mehdi from Radio Canada.
Can you hear me?
Oui.
Yes, we can. Good. Just a quick follow-up on the issue of mask wearing. You said that in some provinces it's no longer mandatory and it'll become a personal choice. Personally speaking, are you going to continue to wear a mask if it's no longer mandatory in Ontario in 2 weeks' time? Or do you think it's going to be too soon to stop wearing a mask? What will your personal choice be? Well, thank you very much for the question. You know, it's all about performing one's own individual risk assessment and determining one's own risk threshold, what one's comfortable with. It's important to look at the regional epidemiology of COVID-19, and in my case that would be in the Ottawa region. So at least for my part, I'm going to continue to wear a mask for some time coming, especially in enclosed places such as shops, stores, even at events that are returning to full capacity. So personally speaking, as a way of managing risk, I'll continue to wear a mask. I'm fully vaccinated. I've also been boosted, so to speak, but I'm also prepared to say here that I'm over 50, and so it's important for me perhaps to continue to err on the side of caution and use every layer of personal protection possible. Follow-up. What about the study on children in New York about the effectiveness of the Pfizer vaccine against Omicron? Apparently, there's been a drop of 12% for 5 to 11 year olds. That's a huge drop. Were you surprised by these results? And what can that mean here at home in Canada for us? Response. Well, it's going to be important to continue to follow the findings of clinical studies and trials on the vaccines. And I'm absolutely sure that Health Canada is following the situation very closely. Of course, it's important to analyse the scientific data on an ongoing basis, and the onus is on the regulators to undertake their own analyses with a view to either improving or not improving certain vaccines. But for the time being, I believe that in the case of the vaccines that are already available in Canada, well, they're available and being used broadly by those over 5 years of age, so that's a great thing. But we need to continue to follow the science closely, especially the clinical trials for children under 5 years of age. Maybe I can just tack on to that answer. We're talking about a small, it wasn't a very large study, and Pfizer is in the process of undertaking a clinical trial for booster doses for children between the ages of 5 and 11. And we'll perhaps get our hands on those results pretty soon.
Just a reminder, if anybody wants to have a question, please use the raise hand function so I can add you to my list. If you already have your hand up, you are there. But if you have not done so yet and you would like a question, just please do so. With that in mind, up next is Mia Rabson from the Canadian.
Yeah, good afternoon. I'm wondering, Dr. Tam, if you could talk a little bit about how much we know about sort of the natural spread of COVID-19 at this point, how many people have actually had it, given that we haven't really been testing that widely in the last few months, and whether or not that, combined with vaccines and the high rates of vaccines we're seeing, does give any sense of herd immunity at this point.
Yes, I think we are still waiting for some studies. You've seen of what we call seroprevalence studies. So they measure, they sample the population and measure the antibody levels using a number of different kind of tests to detect antibodies against different proteins, the spike protein and other proteins of the virus. And you can tell the difference between those who got the immunity, perhaps as a result of vaccination only, or also as a result of infection. We don't have that many of those at this point for the post-Omicron situation. So we will be looking at that very closely. But there are some individual studies, for example, in the Montreal area for children and others that are being reviewed at the moment. And there has certainly been quite a large proportion of individuals who actually had the infection during the Omicron wave. And I do think that if it's Omicron that's circulating in the next months, we have a very good level of protection in the community, particularly with boosters, protecting against severe outcomes. But if there's a variant that's very different to Omicron, then that's a different story, and we will have to evaluate the risk of any vaccine evasive variants. So there is no such a thing as a sort of threshold, as it were, for herd immunity at the moment. But I think the level of protection in the community has got to have significantly risen in the last months with increased vaccine coverage and the infection. And that's the same globally as well.
Thank you. I'm wondering if we also have any update on the BA2 numbers versus BA1 and whether growth of that BA2 variant changes things at all, or if it's similar enough to the original Omicron that it would sort of be covered off.
Yes, so in terms of our understanding of the characteristics of the BA2, which is essentially a relative of the Omicron BA1 variant, although there's quite a few differences in the mutations, what the global evidence base has shown is that this is a variant that can be more transmissible, potentially, but there's no conclusive information to say that it causes any more severe outcomes. So that's good news. And the data to this date suggests that the vaccine protection is similar between the two, although there's a few studies that suggest maybe a slight increase in immune evasion from the BA2, but essentially still getting the vaccine is very important, even against BA2 and against severe outcomes. What we're seeing with the Canadian data is that there's been increasing proportion of the identification of BA2 in our population. So at the moment, vast majority are still BA1, or what we call BA 1.1, and roughly 10% are BA2. That's not the same across the country. There are provinces where that proportion is higher, but that's about where things stand at the moment domestically. In our international monitoring through the sampling of travelers, we're detecting a higher level at about 20% of the proportions of travelers with Omicron has the BA2 variant.
Okay, moving on, we're going to go. I want to make sure that that everybody gets a first chance before we move into potentially second round of questions. With that in mind, we're going to move next to Simon Bourassa with Nouveau Info.
Oui, bonjour.
Yes, good afternoon. Ms. Dr. Tam, could you please repeat your answer to my colleague Mia Rabson concerning the BA2, BA1 variants?
Dr. Tam,
Dr. Tam, I can step in and if you wish.
Allez-y.
Go ahead, please feel free.
Alors, c'est Dr. Njoo.
Well, this is Dr. Njoo here. If I could just sum up Dr. Tam's answer, I don't know if you want the figures. Well, should we still be concerned about the proliferation of that variant? And what is the public health doing to monitor the development of that variant? Thank you very much. Well, I can stand corrected by Dr. Tam here, but at this juncture, BA2 seems to be very much like BA1, the BA1 variant. It's a second cousin, if you will. If you look closely at its defining characteristics, it does strike us being a tad more transmissible. But if you look at the issue of serious consequences, or level of protection of vaccines against BA2. Well, the results are very similar to those for BA1. But of course, we're going to continue to follow it closely. Most of the cases being identified in Canada in the case of Omicron are BA1s. There's a small percentage that are BA2s. But this isn't consistent nationwide. In a number of provinces, in particular Alberta, the proportion of BA2 infections is much higher than in other provinces. It's something that we're continuing to monitor closely. Even at the border, we're seeing that the positivity rate is a little bit higher, about 20% among travellers that come to our borders who end up with a positive test for the BA2 Omicron variant. Thank you very much, Dr. Njoo. Follow-up question. I can understand that you're trying to make Canadians take care of themselves personally by performing individual risk assessments for themselves. But between the two of us, would you recommend that Canadians avoid travel, whether be it domestically or abroad? What do you think? I.e., should we be allowing them the choice to make their own decisions? Response: well, we need to continuously monitor epidemiological situation both here in Canada and abroad. But Canada has changed its advice regarding travel for all Canadians. It used to be avoid all non-essential travel abroad, but now it's more of a recommendation, i.e., take a close look at where you intend to go abroad and make your decision on that basis. So again, it's a matter of performing your own individual risk assessment. Perhaps you're a senior. Perhaps you have another underlying condition. Perhaps it would be more risky for you to travel abroad. But it also depends what your destination country is. There's a whole lot of factors that come into play. But one thing I can tell you is that there are a lot of Canadians who are fed up, just like I am, and it might be a good time to take a trip south to a warmer destination during the break week. But obviously, those folks need to be up to date with their vaccinations. They have to have at least had their 2 doses and potentially a booster dose, particularly for those 50 years and older. And Canadians should continue to use all additional layers of protection at their disposal. Mask wearing is an additional layer of protection, which can give Canadians a certain level of confidence when they choose to engage in activities both indoors and outdoors and travel abroad. But regardless of whether or not mask wearing is mandatory in the destination of choice. But the fact of the matter is that Canadians, it's time now to give Canadians the opportunity to take personal responsibility and to make their own choices in terms of risk management, both in terms of exposure to COVID-19 and whether it comes to travelling and engaging activities or not.
Okay, next up, Nick Bower from CBC.
Good afternoon, doctors. Just a question about the provinces, which are moving, in some cases pretty quickly right now to lift some of these restrictions. There could be a situation, depending on which province you're in, where in the near future you could go do karaoke at a packed bar without having to show a vaccine passport or even be vaccinated, but you couldn't get on a train, say, and go to another province. Is there any risk from a public health perspective when you've got Canadians living under what may be quite different rules in the near future?
I think there is different epidemiology in different jurisdictions. So I do think that following local public health advice and watching what that forecast, if you like, of activity is in the local jurisdiction But when you're talking about interprovincial transportation, that's slightly different. And maybe you're traveling across Canada from one spot that's a hotspot to another spot that has very little activity. So I think that kind of risk assessment still has to be undertaken. But I do know that federal government departments, including Transport Canada and others, are watching all of the changes in epidemiology very closely, and will be making any policy adjustments as needed in the coming days and weeks.
Okay, and another question, if I can, on the kids and vaccine topic. We've heard concerns from various public health people around the country about the relatively lower rate of vaccination among children. If we're moving to this point where a lot of restrictions are being lifted, parents are maybe less inclined to get their kids vaccinated, what does that say to you about the outlook for the rest of the pandemic, for the rest of the year, if we have maybe sort of topped out at the vaccination rate that we're currently at for kids?
Yes, I think first of all, we should continue to provide information to parents, check out our videos on talking to experts, and seek out information from your own trusted experts about children's vaccination. So that is still important. I think having those foundational 2 doses is important, because if another variant occurs and you need another dose, and you're starting with 0, that means a lot of time has to be expended in getting that series started as well. So I think that's just something to bear in mind. And as we prepare for even the fall season, you're coming out into the spring and summer, we might expect less transmission, at least in the Canadian context. But we're all trying to look towards the fall now, where not only will COVID-19 potentially increase in terms of activity, but also the other respiratory viruses. And children are susceptible to many different respiratory viruses, and more protection and different layers of protection against them will be very important. I would say, the younger the children and the under 5s, we're still waiting to have authorization for those vaccines. And especially under 1, they are even more susceptible to severe outcomes. So that's something that I think we need to make sure all parents are cognizant of. I do think that as we open up spaces, social economic spaces, as people travel, we will expect an increase in cases. And I think that's just to be expected. But people can, especially if the kids have high-risk conditions, use many different layers of protection, particularly getting the adults around them vaccinated, as well as Dr. Njoo and I keep saying, mask and other measures, ventilation, etc., can help keep our kids safe. But yes, unvaccinated populations can certainly be the pockets of increased transmission into the future.
Okay, I'm going to try to go back now to Adam, and we'll see if this works. And if not, I will ask questions on your behalf. But we're going to go to Adam Harris from the Telegraph Journal.
Thanks, Jordan. Good afternoon. Thanks for taking our questions. The federal government's still providing millions of rapid tests to the provinces, but I was just wondering if there comes a time when widespread testing will be phased out, or if that's something that could be continuing for years.
It's Theresa Tam. I'll try and answer that question. Yes, so rapid tests, many of them have been developed and many of them authorized, becomes important tools. I do think that there are periods of ebbs and flows of use, if you like, for them. I think I can see going to the future. So there's less value in using them when activities are low. But there's more value when activities increase, or when you have increased respiratory infections and you don't really know what you have, then a rapid test could potentially assist in telling someone whether they have COVID-19. We have to make sure everyone understands how to interpret those tests and the limitations of those tests. So that education is another one of those, increase measures that we can take going forwards. So I don't know the final answer to your question. We will have to keep watching the evolution of the virus and the pandemic. But it's great to have that additional tool. And we can flexibly use it into the future if we have to, even if we're not doing more regular testing.
And with provinces lifting restrictions, does testing regimes become more important in the interim or not?
Well, I think, again, they are supplementary to a number of other measures, including the regular surveillance programs and the regular PCR testing programs. But I think they are very useful if someone has symptoms and you don't know what it is, and you're opening up society and someone has symptoms, then I think the rapid test could be valuable under those circumstances. You've seen provinces now beginning to adapt their testing strategies. Nova Scotia, for instance, is now able to follow up with PCR confirmatory tests even after a rapid test because the numbers have come down a bit. So I think these tools will be used in conjunction. But I do think that as provinces are opening up, we're going to be monitoring the wastewater surveillance. We're going to be monitoring PCR, and the public can leverage rapid tests if the activities are sort of going up in their local environment.
Well, we're going to move on to a second round. And so if you do still have a question, please remember to raise your hand. I see two up already. So we'll start the second round. Yasmine Mehdi from Radio-Canada.
Oui, on en a brièvement parlé tout de suite, mais je veux revenir sur cette exigence qu'on a encore au Canada.
Yes, we touched on this briefly, but the requirement to be vaccinated to take the train or airplane in Canada, when will that measure be in effect to? What's the time frame? When will we be putting an end to that federal requirement? This is Dr. Njoo here. What I can tell you is that we are closely following the data and epidemiological situation both domestically and abroad. We've already observed what is occurring at the Canadian border with test positivity rates. So the news is good. In the past week at the border, the positivity rate, particularly among travellers who are fully vaccinated, has dropped substantially to about 2.8%. This is really good. It's much lower than it was previously. And it's something that we will factor in going forward when we consider making adjustments. Follow-up. I know that there's no longer a requirement to take a PCR test to come back to Canada. It's a rapid antigen test. How can you justify that measure, knowing that these rapid tests are not really reliable? What criteria are you basing your decisions on? Response. Well, thank you very much for your question. Having that requirement, a rapid test that is, when arriving in Canada, is another layer of protection for Canadians. And it reassures travellers that when they board a flight, that they know that the other passengers have had a negative test. We know that the system isn't perfect, however, and sometimes travellers arriving at the border in Canada, as I just pointed out, end up having a positive result upon arrival. However, that positivity rate is far lower than it was previously. We're continuing to monitor the situation and monitor our policies, so stay tuned. We'll continue to make our recommendations to decision makers and rely on scientific data in doing so.
Up next, Mia Rabson from the Canadian Press.
Hi again. I'm just wondering, you've talked a little bit about needing to make your own choice about wearing a mask if it's no longer mandated. I'm wondering if you could just talk from your own experience or your own plans, how long you would intend to wear a mask, or what might convince you that a mask isn't necessary anymore for yourself.
Maybe I'll let Dr. Tam go first. I think I answered it in French.
Yes, so. I think Dr. Njoo answered it in French. So I think, first of all, looking at the activity level in the community that I'm living in or I'm visiting. So I know that in Ottawa, for example, the level of activity is going down. So that's good news. Then I look at, what activity am I undertaking? Is it outside? Is it inside? Is it crowded? Who am I going to be with? And I'll still be taking those kind of evaluations. I'll take into account my own personal underlying medical conditions, but also the fact that I have elderly parents, for example. I may want to protect them more. So therefore, I'm not going to take as many chances. And if I visit them, I might wear a mask, depending on the activity. So I think it is very personalized, but I do think that as the Omicron wave comes down, there'll be much more opportunities for people to feel more comfortable in removing the mask. I know that I've been vaccinated and boosted. So personally, I feel quite well protected against severe outcomes. So I'll take that into account for sure.
It's Dr. Njoo. I just maybe to add to what I said in French, similar to Dr. Tam. Certainly, every time I leave the house, as we actually said in our opening remarks, you would, just like you would look at the weather forecast before you go and make sure that you're properly, dressed to have the appropriate quote equipment which you need before you go out. Depending on the weather, same thing now. Depending on whether I'm going to, let's say, a crowded location indoors, let's say for shopping, as opposed to maybe an outdoor activity, that would certainly, factor into, whether I would feel it necessary or appropriate for my risk to wear a mask or not. And then, like I said, I think in French also, in terms of, the possibility of traveling outside the country, I think many Canadians are looking at that as they go down maybe south or to other locations. And it's the same thing. You need to look at your own personal situation, your risk factors, and then obviously look at the situation of where you're going and what's the epidemiology, like how widely is the virus circulating in your destination as opposed to where you've come from. And then, of course, look at what kind of activities you're going to be doing. If you're going to be spending most of your time outdoors, maybe, hiking and, without too much contact with other people, that's a different kind of risk compared to recognizing that you're maybe going to a vacation outside the country where you will be mostly indoors, maybe bar hopping or whatever, where there could be lots of people indoors, et cetera, and so on. So I think it's all a matter of taking all those factors into account, and then obviously, based on your own risk tolerance, whether you would want to continue wearing a mask or not in those circumstances.
One other point that I think Dr. Njoo mentioned in French that I think is actually important to repeat is actually showing compassionate and support for others. I think, whether you decide to wear a mask or not, think about who you're with, and maybe they're at higher risk. So having that consideration for others, do not stigmatize people who do wear a mask. Or indeed, there's maybe very good reasons why you don't need to wear a mask under certain circumstances. And so people need to be patient as we begin to learn to come out of that crisis phase into more of a longer term ongoing management of COVID-19. It's not going to be easy. Putting on a specific measure is sometimes hard, and for people to follow what public health is asking them to do. But once a habit is developed, we hope that this just becomes part of your routine respiratory virus precautions that you would take with you on an ongoing basis. But it is not going to be easy. I can see there are tensions, there are fears from those with underlying risk factors that they're going to be going to spaces where people are not respecting those layers of protection anymore. So I think I would ask everyone to be really patient with each other during this time of transition.
You said earlier in your opening remarks that it's sort of time to ease some of the societal disruptions, but we might have to be prepared again if things change or if another variant comes up. But I also remember, and it was you or others saying when Omicron came, that this wasn't March 2020. We've learned a lot. We know a lot more. And yet our response was very similar. The same kind of closures, schools closures, business closures, those same very disruptive societal changes. What can we expect if there's another variant? Do we have the ability to make choices or restrictions that aren't as severe as what we've seen so far?
Well, I think that is the goal. Public health systems across the countries really want to minimize those really restrictive measures, but they may ask people to wear a mask again, for example, for indoor settings. So using some of those measures, I think what has been really difficult to balance this reduction of severe outcomes against societal disruption is the fragility of the healthcare system. So I think during this time of recovery, it's really important to look at health human resource and shore up that hospital infrastructure, your long-term care infrastructure and preparedness. Of course, the public health system itself needs to recover as well. But it was really difficult because of hospitals filling up again and the concern that maybe ICUs will. It just so happens Omicron has less severe impacts, and we've been more vaccinated. But I do think we've got more treatment options now. We've got vaccines, and we will know more what to do with different kinds of boosters. And we have rapid tests, which even at the beginning of the Omicron wave wasn't that widely deployed, but it escalated. And so I think with all of those measures and understanding viral transmission, wearing a mask, ventilation, etc., we've got to be able to go into the fall and winter season, or indeed the next wave, if it should come in between, with much more ability to respond without those really severe restrictions. That is the goal, but we still need to be flexible with the suite of measures should it become necessary. And it's very different, for example, I think in different areas of Canada where the healthcare system capacity may differ. And that's why I think you saw, even right at the beginning, some of the smaller jurisdictions taking more measures because they simply can't afford to have a rapid escalation in their health care system impacts. So it is very difficult, but I am optimistic, and we work with the provinces to see if we couldn't make sure that balance is maintained and improved upon.
I know we've gone through 2 rounds. I as moderator, I'm going to use my privilege here to ask a question too, just to follow up on something you just said, Dr. Tam, which is shoring up the healthcare system. I'm wondering if you can elaborate a bit about how much has been done to do that, maybe in the 2 years, as you point out, since we've entered this pandemic, but also maybe how much more still needs to be done in your mind before you could say mission accomplished.
Yes, and that is, of course, quite a big question, which the decision makers need to grapple with. I do know that a lot of work is being done right now to look at the strengthening of healthcare systems in many ways. I think the biggest need is in the health human resource, particularly when the health teams are so exhausted. And so I think there are many different avenues of exploration. And I'm not really the lead on the healthcare system, so I'm going to have to point you back towards Health Canada and the minister himself, maybe, to take those questions. But we have learned quite a lot. One is, I think, looking at the surge capacity requirements. I really feel that the partnership with the Canadian Red Cross, for example, has been particularly important. They played a really big role in providing surge as needed, but there's a finite number even of that resource. The federal government itself provided our own staff to some of these situations. And as you can appreciate, the Canadian Armed Forces cannot just keep surging. They've got many other priorities, as you've seen globally with different activities right now that's taking up their area of focus. So training requirements, looking at licensures with the regulatory bodies across the country on really making sure that we've considered how we leverage international graduates and credentialing different health professionals in that area. All of these come into play, I think. And this is a subject that is of great importance, but I might not be the most knowledgeable about that. The other thing is virtual care has become a real reality and was boosted during the pandemic. So knowing how to best use that for going forwards, I think would be very important as well.
Thank you for that. We still have just a few minutes, and I know there's only a few people left on the line. So if anybody has one final question, you can use the raise hand function, and I will squeeze you in now. Seeing none, I think we can wrap up for today. Dr. Tam, Dr. Njoo, thank you very much for your time as always. Thank you to everyone for joining us. That concludes today's press conference.
Thank you.
Merci. Bonne fin de semaine.
Enjoy your weekend.